My name is Dr. Njabulo Mabaso. I'm the medical director for AIDS Healthcare Foundation Clinic, which is called Ithembalabantu Clinic in Umlazi, Durban, in South Africa. We mainly provide antiretroviral treatment to the resource poor settings to our clients. And we also provide psychosocial support to the clients, nutritional support, and as well as HIV testing. Okay, I think from my perspective of things, I just want to commend first the conference organizers to say in this conference they've actually raised the bar in talking about the issues of homophobia, sex work, which has been sidelined in the past, but there is still other issues that I think need to be taken care of. For example, in Africa, where I come from, there is the abuse of drugs by drug users, which has not been coming out to the expose. For example, in the poor community where I live in, people smoke marijuana or what is called dagga, and they mix it with stock cream so as to get a high. And the scientific community has really not looked into that into detail as to what are the effects that will have in terms of into the general population and into the future of stock cream as a drug. And I think it needs to be thoroughly investigated and researched, and maybe given some prominence as well in conferences of this setting, so that people can be aware of that and start acting on it. I really will agree with the universal access to treatment, because in many other places there's still limited access to treatment. For example, my neighboring country, Zimbabwe, it might be politically unstable, but there are people on the ground who are suffering, and I will think that because of sanctions that have been imposed in Zimbabwe, funders are not going to Zimbabwe because of political sanctions. But at the end of the day, a life of an individual, an innocent individual who doesn't know anything, in my view, is more important than a single, political person who's blocking an international, assistance that could go into that part of the country. And so I will really hope that this theme of universal access to treatment and universal action is really taken into practice and implemented.